right, everybody. Welcome to Barrett Plastic Surgery, and I'm Nurse Pam with our beautiful patient right here, Lauren.
Hi.
And we're here to do collagen induction therapy. So she's done it before, once, but she's never done it here. So she's gonna try the best.
Oh yes, I'm ready.
Here we go. So before we do the collagen induction therapy, we obviously have to numb the patient for better comfort and also for a better experience. All right, everybody, we're about to start our treatment for Miss Lauren, and we are leveling up her treatment with EXOSOMES. So we want her to get the best results. We want her to heal quicker and just bump up that collagen production. So normally, as a provider, I always start on the forehead. It's one of the most sensitive areas of the face. I go on the forehead at 0.5 depth, and then I move downwards from the cheeks, around the lips, and then the chin area. As I'm doing the microneedling, I'm also infusing the EXOSOMES together with the PRP, which help facilitate collagen induction and also faster healing. In order for someone to see visible results after collagen induction therapy, they would need at least 3 sessions of about 4 to 6 weeks apart.